Meanwhile, the daily average of COVID cases in Michigan continues to fall. It's now below 3,000. It hasn't been that low since September. But just how accurate are those daily numbers?
A viewer asked the 13 on Your Side Verify team whether the current testing strategy may be leading to some mixed signals. 13 on Your Side's Charlie Tinker went to the experts to verify.
The rise of the highly transmissible Omicron variant has more Americans increasingly turning to one of several now widely available home test kits. Laura from Grand Rapids asked us, can you verify if there is a correlation between the decrease in COVID cases and people testing at home with government-issued tests that are not reported to the CDC? Our sources, the Michigan Department of Health and Human Services, self-testing guidance from the Centers for Disease Control and Prevention, and Dr. Andrew Jameson, Division Chief of Infectious Diseases and Medical Director of Infection Control at Mercy Health, St. Mary's.
It absolutely is taking our numbers down.
And the speed of that decline isn't translating to what experts see in the hospital.
Our active cases per 100,000 rate is definitely underrepresenting what is actually happening in the community.
It may be because there is no self-reporting requirement. In its guidance, the CDC only strongly encourages those who test positive to notify their personal doctors or their local health department.
I think that most people that test positive are not reflected in our county numbers, so I don't think they report.
MDHHS seemed to arrive at the same conclusion in a statement it sent in response to my questions when it revealed results obtained at home generally aren't reported, though it's impossible to know how many actually do so or don't. It's not as simple as plotting the raw data alone either. The state said it also factors information gathered from wastewater surveillance and hospitalization rates into its strategy, both of which would reflect the situation on the ground, regardless of testing procedures.
If you are sick with COVID and need to get hospitalized, you'll show up. What we're also seeing in the hospitals is a decrease in our hospitalization numbers.
Meaning when it comes to the VIEW numbers are declining, that's still largely accurate. So we can verify, yes, there is a correlation between the rise in testing at home and declining daily case counts as reported by state and federal agencies. To what extent is unclear, but public health officials do have other metrics at their disposal to measure the impact of COVID-19. With your Verify, I'm Charlie Tinker.